happy to see all your smiling faces today here in the Coralville Library. And this is the Heritage on Aging, Johnson County Task Force on Aging program. And today we're going to have an exciting program with an awesome and amazing speaker, Dr. Brian Kaskie. And I did want to just talk a little bit first about our Task Force on Aging, Johnson County Task Force on Aging. We meet monthly, the second Mondays of every month, from 1 p.m. to 2 p.m. Is where we have people that are a part of the voting committee and a part of the board. So if you all have any interest out there, we are certainly welcoming anyone else that would like to be a part. Heritage, you can call their telephone number at 800-332-5934 if you feel that you want to be a part in making a difference here and some of the things that the Johnson County Task Force on Aging has going on. So our next month program will be May 13th. It'll be at 2 p.m. here at the Coralville Public Library. And it's going to be a legislative recap. So you want to come out and listen to some of the individuals that is going to talk about what's going on for elders within our state and within our own community here. The telephone number again for a Heritage Agency is 800-332-5934. And next month is an exciting month because it is Older Americans month. And so celebrating the lives of all of the people that have done great things here in our local community and even throughout the state and national on things that have made life for older Americans better. Today, I'm honored to present our speaker for today, Dr. Brian Kaskie, who is an associate professor in the Health Management and Policy Department at the University of Iowa. He earned a master's degree at Washington University in St. Louis, doctoral training at the University of Southern California, a postdoctoral fellowship in health services research and policy at the University of California, San Francisco. Most recently, Dr. Kaskie served as APSA Congressional Fellow. Dr. Kaskie's primary interest concerns the intersection between public policies and older persons. He has a history of contributing directly to the formulation and implementation of public policies concerning older adults. His past and current work has involved the Alzheimer's Association National Public Policy Office, the project manager for the State of California Strategic Planning Initiative for older adults, providing legislators and agency executives critical guidance in formulating policy responses in the state with the nation's largest population of older adults. In Iowa, Dr. Kaskie has been appointed to several committees and task force, and he actually sits on our task force. Dr. Kaskie created the University of Iowa Multi-Disciplinary Graduate Fellowship in Aging, authored the Iowa Board of Regents Strategic Plan for Geriatric Care, and currently directs the 2 graduate degree programs in health policy offered at the University of Iowa. Please help me welcome Dr. Brian Kaskie for the program today entitled Exploring the Elder Abuse Pathway in East Central Iowa. Dr. Kaskie.
Make the slides a little more. So thank you for coming out today. Want to make sure that in the next hour we cover the following. We understand why we're concerned with public health nature of elder abuse and neglect. We're going to take a look at what's been happening at the federal level, and then we're going to review what we found here in a study of Johnson County, East Central Iowa, actually Lynn Corridor County as well. And then we're going to talk about where we can go with all of this. So this work started as pardon me, as I served in Senator Susan Collins' office for the United States Special Committee on Aging, and I met Andy Mao, who's the director of the Elder Justice Initiative within the Department of Justice. And with that, we also worked with Susan Lynch, who's out at DOJ. And out here in Iowa, in the Northern District, up in Cedar Rapids, as we'll talk about later, they won an award from the DOJ to look into elder justice at the regional level. So Jake Shunk up at the Iowa Northern District participated, Len Sandler over at the University of Iowa College of Law, and Jill from the Heritage Area Agency on Aging all contributed to this effort, which has now been about 2 years. I don't really need to remind this group about the basics of aging. We're getting older and there's more of us, and it's not going away anytime soon. This is the biggest transformation in our social fabric in the last century. One thing I came across when I was out at the Senate committee is an old volume published by the National Lab. National Lab is the royalty of the scientific community. In the late 90s, they actually wrote a whole series on demography of the aging population and explained how it's just going to transform our social and political fabric. We're going to need more housing, we're going to need more sports, we're going to need more insurance, and we're going to need more protection. As you know, with age comes certain risk factors. We have a diminishing cognitive capacity. If you're over the age of 90, right now you have a 1 in 2 chance of suffering with some form of a cognitive impairment. Another risk factor that is unique to aging experience is to get increasingly physically frail. It's harder for you to move around, harder for you to remain independent. But along those lines, we have increased social isolation. So we have people living at home alone with memory impairment who have a hard time getting around. Makes them vulnerable, I would say. So this is my mom. My mom was born and raised here in Iowa, Des Moines, went to Iowa State. She is a proud mother of 6, lifelong Catholic. I was going to say devout Catholic and lifelong Republican, but lifelong Republican and devout Catholic, devout Republican, lifelong Catholic. But more importantly, towards the end of her life, she had cognitive challenges. She was having problems remembering things like picking up one of her sons at the airport. But she is so fiercely independent, she would not move back up here, back north. She wanted to stay in an assisted living facility down in Florida. She enjoyed it. She had her friends to watch after her. But then there was a time my brother and I went down and found one of these letters, and we found something in her checkbook, which she was ready to send off, because these letters look very real. These are notices from federal agencies that say you either won money or you owe us money. Fortunately, at that point, when my brother and I saw that, we decided to step in, become a little bit more assertive with being co-signers on her financials, and we were hopefully able to divert that. Wasn't the case so much for my Aunt Marita. Here's a sampling of the mail we found last December. Came to her house because she answered one of these ads. If you look closely, we got all sorts of political rancor here. We got Edith Ginsburg, we got Donald Trump and the caravans, we got James Comey, Bob Mueller, lots of scary things. And if you give it $20 now, we'll take care of it for you. And the issue is, once you get on one of these mailing lists, then you get shared to all the others. And then they start calling you. And because you're at home alone, and because you don't get out a lot, and because you have diminished memory and thinking capacity, you start thinking these people are your friends. And you start telling them things like who other people in your neighborhood or in your family might be willing to donate to such a cause. Marita's case, she spent, let's just say she spent a lot of money. And we had to go back down there in December, spent about a week unearthing all the different strands of abuse and fraud she was being perpetrated against. This stuff is real, and it's very different. There's different kinds of elder abuse and neglect. There's a simple neglect, that is the caretaker's not coming by and making sure you're fed or changing your bedding if needed. There's self-neglect, where there's just those of us who say, you know what, I'm just not going to take care of myself as well anymore, or I just don't have the capacity to do so, and I haven't found sufficient help. There's what I just talked about, which is financial exploitation. There's physical and psychological abuse that goes on, often by people we know. And then probably the most dramatic kind of exploitation is sexual abuse and exploitation. When I talk about elder abuse and neglect, I'm talking about all of these. Okay, so as we go forward, we're talking at a pretty high level here about any number of these that older adults can be victimized to. This is a priority for Senator Collins. We continue to hold hearings and do reports on these at the federal level. There's an entire wing of the Senate Committee on Aging that's staffed up simply to receive calls from people across the country who said, you know, my mom just got something to mail. I have no idea what we should do. We become a clearinghouse for them. Elder abuse and neglect has also remained on Senator Grassley's agenda. Now that he's over on the Committee on Finance, he has jurisdiction to hold meetings about nursing homes, because nursing homes fall under Center for Medicare and Medicaid Services, which fall under the jurisdiction of Finance. They spend a lot of time going over bad things that happen in nursing facilities and coming up with ways to prevent those from happening in the future. However, most of the work in the elder abuse and neglect space has historically been left to local jurisdictions. You know, your local sheriffs, your county attorneys, your local adult protective services. Historically, as you might imagine, this has not been on their radar. We just haven't had the demographic phenomenon that we're experiencing today with so many older adults who are moving into dependency status and then require intervention from APS. APS historically operates knowing people are coming into the system already declared to be dependent. These are adult children with developmental disabilities, children who don't have parents to watch after them. They're identified, they're known. The trick with older adults is most of us cruise along just fine, and only after a while do we become qualified as dependent. We'll revisit this point in a minute. But it explains why APS really hasn't done as much in this space as we thought. What comes next is the Older Americans Act. So as a way to supplement what happens in APS, we have what's called the Aging Network. Our friends at the Area Agencies on Aging, they have some jurisdiction now for elder abuse and neglect, and they're largely here for education and support. We're being educated today. We're also being supportive. We'll do referrals. If you do think something's going on, we'll help guide you through the process of having someone out and kind of do an assessment and then perhaps a referral for an investigation. Challenge here is under the Older Americans Act, it's not a very big budget that goes out to support these ventures. So what we had over the last 30, 40 years of these different agencies at the state levels have kind of taken varying approaches to how much they look at older adults. And what you hear often when you talk to these folks, silos, right? When you hear that from somebody who's a state agent, that's pretty much telling you, you know, we got a program that's failing. Code word. When you hear somebody in a speech or talk say, yeah, it's all silos, it means they haven't figured out how to coordinate things. And that's kind of where we were up until 2010. The great thing about 2010, as part of the Affordable Care Act, we snuck in something called the Elder Justice Act. The Elder Justice Act essentially said, you know what, we recognize we're not doing enough at the state level. We know the states need help. We're going to provide sort of a baseline or a ground floor of support here at the national level. You states can decide how to go from there. So what we have on one level is grants and supports have been made available through the Department of Justice. Early on, I made reference to Jake's work up in the Northern District. Well, now they have a group that's looking into elder justice issues. You may have heard that they just caught a group out of Dubuque, Iowa, that was perpetrating over $1 million worth of fraud on local seniors up there. They're all now being sentenced to jail because of the work going on in Northern District. Another arm of the federal government that's been involved with this is the Center for Disease Control. What they're doing is they're trying to cross those boundaries. They're starting to connect those silos and say, look, different agencies here can work together. They come up with standard definitions because that's always a problem. One agency says, well, this is what we think is abuse. Another agency will say, well, this is what we think it is. And that's pretty much enough to stop forward progress. Well, coming up with standard definitions and data collection are important. We'll come back to visit this later. If we don't know how many calls the police receive in any given month about how many older adults might be at harm for elder abuse and neglect, we'll never know what the scale or the size of the problem is. This is the same problem that happened with women in domestic violence through the 80s. Nobody actually ever wrote down how many times they called. Once they started to, they realized, oh, this is a much bigger issue than we thought. So data collection is important. Finally, the Administration on Aging supports the Aging Network through education and outreach. They support case management, come out and assist in situations of suspected elder abuse and neglect, and they'll provide supplemental services to help people out during difficult times when they are in a situation of abuse and neglect. So our job with the Department of Justice, I said, well, let's see how all this is working. All these great initiatives started in 2010. They're starting to trickle down here to the state level. Let's see what's going on the ground here in the East Central Iowa corridor. So what we knew to go into this was that most cases of alleged elder abuse aren't even reported. So you may see a neighbor, you may see a sibling, you may see an in-law, and you may suspect something fishy is going on with someone else getting into their finances, or someone else not coming by and taking care of the house or fixing the heater, or worse yet. And yet, because we haven't really thought of it as anything more than, well, they're just older, they need help, or, that's the bruising you get on your arms, that's because of the medications. We talked ourselves into ways to not think about the possibility of perhaps this person's experiencing some type of abuse or neglect. If you're to see bruising on a child, it's in our mindset in comparison to think maybe that person's not in a situation that they should be in. And we also heard before we started that Iowa has a really high bar, meaning to get into this adult protective service system, to get actually formally processed, you have to be, known to the system as a dependent. And as I said, that's problematic for persons who are aging along independently, doing just fine, but then become dependent because they're not known to this system. It sounds like a catch-22 to me. We'll see. So what we did is we looked at a pathway. What's going on here in our community up in Cedar Rapids or down here in Iowa City or Coralville. So the first thing we want to know is how much public awareness do we have on this issue? Do people know about elder abuse? Then what do people do when they identify? Do they know where to go? Do they have intake and referral processes that make sense and accomplish your goals, to document what might be going on and then to refer, if needed, for formal investigation? And when formal investigations are done, what happens on the legal remedy side? Do we have a prosecution? Do we have criminal prosecution? Do we have any civil proceedings against these cases? We wanted to cover the whole territory. So what we did is we had all-comers meetings. We had 6 of them between late 2017 and early 2018. We brought together everybody we could think of that might be involved: county lawyers, sheriffs, police officers, mandatory reporters, people from Heritage. And we just said, tell us what you're seeing in the system and give us any data that you might have to help us reconcile how it should be functioning relative to how it really is. This took a long time. We went back to the College of Law. We reconciled what we saw in the system with what the legal code says should be happening. And then we produced a big report, which I'm glad to say actually just was published in the Washington University St. Louis Law Review. So we're making tracks with it, not just here, but elsewhere. So what did we find? Well, what we did is we first went out and said, well, what does it look like to have a public awareness campaign on elder abuse? And we found other states seemed to throw support behind us, and they had campaigns all over the state. Illinois has billboards posted up on the highways. In Texas, they run commercials, for example. In Iowa, we seem to, this seems like an evergreen topic, and we hit on it about every 10 years, based on what I see. 98, we said, hey, we need to have some conversations about elder abuse. We did. In 2006, we said we need to have some forums on elder abuse. We did. And then 2017, as an extension of the Elder Justice Act, IDA got about $250,000 to talk about it. Just by way of comparison, children's abuse allocation here in the state is about 10 times that much. So we got some money, but could be more. So what did we learn? Well, that money doesn't go too far, right? Once you distribute it in the network, it's not much left for Heritage, for example, to mount an effective campaign beyond some website work and some late night radio and TV ads. When we talked around generally, people outside of the network really had no familiarity with elder abuse. They couldn't tell you how often it happens. They couldn't tell you what it looks like. They couldn't tell you what to do if they did think someone was experiencing it. So this is pretty common, okay, experience when we talk to bankers, police officers, okay? Just wasn't there. You folks, you're familiar with this. It's the people outside the room that really don't have any, how should we say, awareness or attitudinal factors that suggest that, hey, when I see an older adult and they might be in trouble, that might be a sign of elder abuse and neglect. Just don't think like that. So the first recommendation is we need to scale up the campaign. Again, think about what happens when a child shows up to school or a library or a doctor's office and there's some sign that may suggest there might be something bad happening. Most of us right away think, okay, I should do something. We just don't have that with older adults. See something, say something. We don't sear that when it comes to the aging space. And the easiest way to solve this is to simply get an allocation from the state. Now, I say this, this is a state responsibility. Typically what the state will say, and as we see in Heritage have to experience, oh, you need to go get a grant. You need to go somewhere else to get that money. And this is a game of, I call whack-a-mole. It's just, we're not going to expend the money on this, but if you go get money somewhere else, we're not going to stop you. Well, that money that was available through the Elder Justice Act is, well, guess what? Being restricted now. So whatever support Heritage had for that campaign, it's going to trickle away. And then, again, you probably won't come back to this for another 10 years if we don't do something about it then. So, next thing is identification and reporting. What do you do when you see it? What these things people are called, not things, people, they're mandatory reporters. I had no idea who the mandatory reporters were, but apparently there's a lot of them now. Nurses, okay, firemen, police officers. If they see something, they are required to report it. We just went through this training at the university. As a person who's in a position where I supervise students, who I hire staff to work for me, if I see something or if something's reported to me, it's required that I report it up to my superior, and then we have a chain of command that follows on that. So, in other states like California, they have a pretty extensive training and development for mandatory reporters. They'll teach you what to do, what to look for, if you are interested in this topic. When we came here to Iowa, we found that there's a wide range of reporters, but after that, it was all over the place. What reporters thought was reasonable form of elder abuse varied, okay? They didn't know that they had to make reports to the APS. In a lot of cases, they knew they were a mandatory reporter, but I don't know what to do. And I don't think the person's a dependent, so I'm not going to report them to APS. Not sure. And perhaps most important, there's really no teeth on our obligation to mandatory reporters. If you see something and don't report it in a timely manner, there's no liability on your end. You know, I could see a bunch of teachers or doctors or police officers, saying, no, I don't want this responsibility. So I'm pretty sure anytime we bring that idea up, it gets pushed back on by the mandatory reporters themselves. So what did we find? Well, as you might suspect, where mandatory reporting was going on was in the aging network. People who've gone through formal training, people whose jobs were specific to serving older adults, people who've seen this before, had familiarity with elder abuse and neglect cases. Okay? We didn't hear any other of the mandatory reporters we interviewed talk about ever making a phone call. We just don't. And what was interesting too is a lot of people held this belief that even if I report it, this was interesting, this is sort of a country wisdom here, the older adults themselves won't want to carry it forward. They don't want to get in trouble. And we didn't hear this from older adults themselves, mind you. We heard it from the other people who were supposed to be protecting them, serving as mandatory reporters. It kind of resolved that there wasn't much you could go forward with if the older adult himself felt threatened by the idea of reporting the incident. So here we ask, well, what should a mandatory reporter do in this case? Okay. We need some sort of basic training and education for these folks. Okay, we need some amount of responsibility for them to adhere to as far as when to report. And then last, we need to encourage them or discourage them from not reporting. We have something here in Iowa that I don't know is very active, but I've been reading about this. It's called the Medicare Senior Patrol. Anybody heard of this one? Yeah, right? I'm not making it up. What it's supposed to be are older adults looking out for each other. And if they see something, in this case under Medicare, fraudulent billing or malpractice occurring, by law, they're supported by CMS to report that. Okay? And they're encouraged to do it. And in some cases, they get training and they're not given financial support, but they're given the ability to actually see a case through. That is, by the time they file a case, they're called in to say, what did you see? It's a formal process. We also could think about involving people in the process for what we call, in the case of identifying people who are engaging in financial or fiscal fraud, you get a reward. If you can identify somebody and there's a claim made that they stole X million dollars, some people are saying, well, the initial reporter, right? We've seen this in other cases. They get a reward for reporting. That's another avenue to pursue. So finally, we get to an actual case where it looks like somebody might actually be experiencing elder abuse and neglect. So what do we do next? What's the preferred process for intake and referral? Well, the first thing an APS person does is they qualify if the person's dependent or not. Remember, we talked about this? In order to receive services from the state, you have to be known to the state as a dependent. Tricky thing, but that's how it works. So most older adults, the problem is, here's the catch-22, aren't identified as dependent because they've aged into dependency. So it's not like in the middle of my mom's early mild dementia, she decided that it was time to go down to DHS and say, I'm a dependent now. Remember, most of us are fiercely independent. We try to hide when we're becoming more dependent. Is usually how it goes. So this right away works against actually being able to do a thorough intake and referral, because most times when a APS agent is called, they'll say, well, they're not in my system. They're not dependent. And until I go out and get them declared as a dependent, I can't do anything. So what happens? We support other people stepping in, maybe helping out with some services that are immediately needed, right? Kind of reducing the acute distress of the situation we were called into, and then hopefully, Heritage takes over, right? But we never actually end up doing a formal assessment or an intake of what was going on. The other way is that the person is found to be dependent already. These are persons who are known to the system. It's a much smaller number. Okay, and then APS will do a formal investigation. And what they will do is they'll still engage the aging network to say, hey, we're not a social services agency, but we think in this person's case, if we got some meals programs out to them, or if we got a care manager out there once a week, that would really help them from either the neglect or self-neglect that we observe. And then in cases that rise to the level of having sufficient amount of evidence to suggest somebody is perpetrating an act of fraud or abuse, we're going to refer them to criminal investigation. Okay? So here's the thing. We looked at what other states were doing, and they have these varying amounts of evidence criteria. Okay? Some states, you need a preponderance of evidence. Other states, you need a clear and reasonable understanding of the evidence. So I don't know what that means, right? But what we did notice is other states, most other states, not us, have come up with a streamlined approach to doing an intake assessment. So it's called a uniform process. So everybody's being asked the same questions. Okay, the same pieces of evidence are being collected across the entire state. So when you take that evidence and go back to your office and then say, do we meet sufficient preponderance of having evidence to take to the police or local sheriff? This form will tell you yes or no. Other states, minority, it's up to the APS how they get there. So again, we use this dependent standard, but we also have a few other qualifications to make it, again, a little difficult to have a person actually go out there and do a formal intake and assessment. Okay? Now, this is what's...
Can you back up a second? Abuse. You haven't explained abuse.
Elder abuse and neglect. Could be physical abuse, could be psychological abuse, right? Remember those early categories? Okay, so...
Financial abuse?
Right. Fraud, perpetrated, exploitation. There's a lot of different words.
Okay.
But there's a big bucket of things. So abuse is certainly one of them. And abuse comes in many different forms. Now what's interesting here is that Iowa is on par when they do go out and they do check on people, when it happens, they accept about 40% of the cases. Okay, and that's about the national average. Now remember, this is all new information because 5 years ago, we weren't even collecting this data from state to state to state. That's what that CDC study was doing. So 5 years ago, we could never tell you. We don't know how many cases are coming forward. But here's the issue for Iowa is that even though we brought in about 40% of the cases, we only found about 20% of those cases actually qualified as an actual potential case of abuse or fraud or neglect. Okay? So we came out to the same extent, but once we got there, we didn't find as much. Okay, follow me here. In Illinois, they went out and did about 7,800 investigations. Well over 30% of those, they found enough evidence. We took another state, same thing, almost 40% of the cases. If you're getting that far along in the process and you're having an intake done, the chances are you're going to have enough evidence there to say something's going on should be that high. Not so much here in Iowa. So this is what we call a break in the system. Something's going on here. By the time somebody from APS gets out there to the determination of whether or not they think this is meeting criteria for criminal referral. Now, when we talked to folks and said, hey, what's going on with this? We noticed it in the data. They said, you know, this is a tough job. Okay, we got a lot of cases here. We have a high caseload. It's not just older adults. We don't have a lot of resources. You've heard about cutbacks in the state. Well, this is real. I don't have time to drive out there. I don't have the understanding of different privacy laws. So when I need to go check on with a medical doctor, they throw out big words like HIPAA, and I get like, oh, I can't do that, or I think I can't share documents with other people in the aging network, and it's just too confusing, and I stop. The problem is, what we heard a lot is somebody will refer, somebody will say, I think something's going on, I'm going to call APS. And that may come from Heritage, that may come from an emergency room nurse, it may come from a lot of different places. Well, the issue is those people get upset because they never hear what happens. So if APS doesn't follow through, Heritage never hears that. They don't know if this case got settled. The nurse in the emergency room never knows if the fact that she referred this to the appropriate authority actually got anything done. And again, I'm not here to blame anybody. It's just we're stating what we observe. In the APS world, things get bogged down, and they could use a little support. Indeed. One thing we could do in other states, they've adjusted the dependency standard. They made exceptions for older adults. They call them at-risk or vulnerable older adults because they recognize in Minnesota, for example, not everybody's born dependent or everybody's recognized as dependent. They age into it very slowly. And so even though somebody in Minnesota may not be known as a dependent, they're considered when APS or the area agency goes out there to be at risk or vulnerable, and then therefore they can go down the formal evaluation pathway. Okay? When someone is not determined to be dependent, we still need to get them attention. You don't just get called out to these individuals' homes for no reason. You usually do go out there and find that they're in need of some support. I'm getting nods from our case management friends. Okay? So we could use a tool as well. It would be nice if all the system was using the same intake. I'm having flashbacks to about 15 years ago. We tried to get the aging network to adopt a uniform tool, right, for entry into the labor program, because we had these tools that they use. Wasn't that a fun time? Because the aging network itself was like, no, we're used to doing things our way. Don't have us change. So that's a problem. The group you think most likely to benefit from having a tool might be the group that's most likely to say, no, not ready for change there. We don't have the IT to support that. So at last, the other thing too is back to the aging network. Even though someone may not qualify as dependent, we can still go ahead and offer them services. Again, a lot of people are in distress. Could benefit from meal services, transportation services, someone just driving by and checking in on it. Investigations. Well, this is when the intake and referral at APS reaches that level, right? When it reaches that level that there's a sufficient amount of evidence, they'll get referred to law enforcement for investigation. They'll call up the sheriff, they'll call up the local police department, and they'll say, hey, we got Mrs. Jones out there on Route 1, and you might want to go out there. We were out there yesterday, and there's a lot going on. Again, back to the uniform intake and assessment. What can you tell me? If they had the standard tool, the APS people could just ship them the tool and say, this is what we found. But if they don't, it's going to vary on what the police officer hears from the APS agent. So when law enforcement takes over, they'll usually go out there and they try to gather evidence. If they have that tool that was provided to them by APS, it's easier to do that. If they don't have that tool, And if they're a police officer who has no training in this area, chances are of them finding evidence, well, not so great. If they do find enough evidence, in those cases where it happens, they refer it up to the attorneys. Okay? But most cases, what we heard from the sheriff and the police departments in the East Central Iowa corridor is we often go out there, we don't have a map when we go out there, we don't find enough evidence to move forward. Okay? And so then we just say, call back APS or the AAA and say, we're not seeing anything. But what they often say is, we think this will resolve itself. Sometimes when we come out there, it's enough. Okay? In the case of my Aunt Marita, my wife, I said, go and meet the sheriff. Okay? A new sheriff was elected down there in Clinton County. And I said, just have him drive by about once every 2 months and stop in. Because the other person who was coming over and taking from Marita, if she sees a police officer driving by more frequently, that's enough to scare him away. Okay? So that's how the police look at this. If I just show my badge or I drive by with my patrol car, that could be enough here to help the situation. That's where their heads are at. So, it's not like that in every part of the world. In California, they came up with a desktop, if you will, application. If you've ever been in a squad car, I've seen them. They're mostly like airplane cockpits now. They have a whole video system up there and keyboard so that when police officers come onto a scene, they can punch in, okay, where are the documents from this case? What did the APS worker see? What should I be looking for? And I'll go into this interview with the family kind of knowing already what's up. In the towns that use this, guess what? They had better outcomes as far as identifying and referring cases of alleged elder abuse, and those cases got put to the county or city attorney and handled from there. Much more likely to happen. This isn't hard, it's a software program. Any municipality can adapt it. So what did we find out here is law enforcement, more times than not, decides not to take any action if they go out. They basically say, hey, this is a family matter. You'll hear stories about, oh, I've known that family for years. There's always fights going on in that house. It's a tough thing in that family. I know the dad's got dementia. That creates a lot of they explain it away. They also say, you know, like I was just saying, sometimes when I come out there, it's just enough to cool off the situation. And again, back to that sort of country wisdom, I call it, or campfire knowledge, the older adult doesn't want to move forward anyway. If they're in a situation where the person who's allegedly perpetrating abuse on them is also their caregiver, that's conflict, that's tough.
I thought you said earlier that the older person does want to go forward.
The older persons are, right. That's what we believe, that they don't want to come forward. And that's what the people will tell us about the older adults who, I mean, that's like telling us, you know, well, the kid doesn't want to come forward because he doesn't want to get in trouble, right? That's what we've heard back in the day of child abuse or domestic violence. We have to say, yeah, maybe, but if we create a system to provide them the protection to come forward or just report or investigate, that's a different approach to how these things get handled. But if we believe, too, I mean, the fear may be real or the anxiety may be real by older adults, but if we go ahead and say, yeah, I understand what you're saying, I won't press this, then nothing gets done. That's what I meant to say there. So what do we want to do? Well, more education and training for law enforcement. You know, a lot of our sheriffs, a lot of our police officers, just this is not what they do. It's easy to put one of these software programs in their squad cars, so if a case does come up and they drive out to the person's home, they should be led through a routine rather than just kind of winging it. And back to where I started earlier, I would love for cities and counties to start tracking how many phone calls they get each month. It's as simple as that. Again, back to domestic violence. Women's reports of violence were never recorded, so we could never tell how big of a problem. And certain towns started to do it, just recording call of domestic violence, call of domestic violence. And then you start to see their log books, just how many calls of domestic violence they got every month. Be nice to start doing that here, so just to see if in fact it's bubbling up on the radar for these folks.
They should be able to track that because they have a joint communications center.
I don't know, we asked.
And they said they couldn't do it?
We asked, and apparently we don't have that data on how many calls came in. They could do it, perhaps, but for our investigation, they didn't produce any numbers. Well, here you go, something for you to do.
So is there not an elder abuse hotline?
Elder abuse hotlines, like the ones that came into the Senate Committee on Aging, we would track it there. Okay, but that's different than a phone call coming into the police department. And that's what I was trying to get at. Until the police department starts logging how often this occurs, I don't think it'll rise up on their agenda as something they need to take care of. So legal remedies, you can have prosecution, that is criminal charges are brought against these folks. Okay, some states, the penal code is more explicit about what happens if you're found to perpetrate abuse or neglect on older adults. Other states delineate the civil code so that if someone does it to your friend or a group of you have been abused, you can file a civil claim against them. Here in Iowa, actually, we have a unit over in Polk County that's very busy. It's a coordinated effort to go out and support investigations of elder abuse and prosecute. And because they're a dedicated workforce and because this is a priority and because they've been working for the community, it's really not shocking to see that they have the highest prosecution rate in the state. Okay, they also have the Assistant Attorney General in Des Moines is going around. She's for the state, not just Des Moines. And she's doing trainings of law enforcement and county attorneys. So back to that Department of Justice grant, that's being spent here. They're trying to shore up the attorneys across the state to take on these cases and move forward with them. They're trying to teach them about what's in the code and what remedies they have available to them. Problem is, we don't have a lot of attorneys out there where they can prioritize this. When we talk to county attorneys, they were of the idea that I've got a lot of things to do. This is just one of many. Back to Merida, when we were down there, we went to visit the county attorney. He said, I'd like to come in and look into this, but I have a, double murder on my plate right now, and that's consuming all of my resources. So in a small town or in a small county, that's what happens. You get bigger items come along, and the attorneys just don't have the bandwidth or the depth to go after these cases. So prosecutions in Iowa, as you might suspect, if you get all the way to this point, remember, it's hard to even identify a case. It's hard to get somebody to move on a case. It's hard to get somebody to then rise to the level of having evidence to then call the police, which then calls the attorneys in. After you go through all those 5 steps, we still don't get many prosecutions out of this. This is too small for me. That would be the orange, the dark brown one. So that's a remedy. Okay, so if you wanted to, if you made it all the way to this level, one of the remedies that prosecution has is to switch out the guardian because they found the guardian to be the one who was perpetrating the abuse. Over there. Right? Most of these don't get anywhere because, again, they just don't have sufficient evidence, or they settle. Or they just say, okay, if you promise not to do this again for 6 months, we'll drop the case. their charges. Or remember, and this is true, sometimes the older adults themselves will drop the charges. They just don't want to see the person, because a lot of times these are people they know. They don't want to see that person actually suffering. So we do need to support prosecution and civil remedy efforts. One way to do this is update definitions on what can and can't be done. One of the things we heard are the fines are pretty small. So if you're perpetrating fraud on an older person, you're collecting $10,000, let's say. The fine for doing that, $500. Not much of a deterrent. The specialized elder abuse units seem to be most effective. So again, back to Polk County, when they dedicated staff to work in this area, they got things done. So the question becomes, can every county do that? Probably not. It's just too much. It's too many resources. So let me go to the next slide. Private is also an option. Civil proceedings. Ever watch Better Call Saul? Okay. He famously organized a class that were being perpetrated on fraud by the assisted living company. They were overbilling them. So lawyers can come in if they want to and represent individual claimants. Doesn't happen very much. Where most of the academics think the solution is in these multidisciplinary teams. So that's why I want to get back to what was going on in Polk County. So these multidisciplinary teams are where you get the lawyers involved, you get the police involved, you get the case managers involved, you get the APS involved, and once a month you get together and you discuss cases and you share information. And when you have these multidisciplinary teams come together, they seem to do a more effective job of not only identifying cases of elder abuse and neglect, but finding desirable outcomes. They get the older adult out of the situation, and if there was someone who perpetrated the elder abuse and neglect, rose the level of criminality, those people get their punishment or just rewards when these teams are available. Problem is we don't have a lot of these teams. They require a lot of resources and staffing. We had one here in the East Central Iowa corridor, it was hard to pull together. Nobody paid for their time. Everybody who was on this team was being pulled in different directions. So what happens is you have meetings where not everybody can show up because of conflicts in schedule. You lose a thread on a case and you're 3 months behind. And then the other people are kind of waiting. It was just difficult to execute. That's what the report out was. You didn't have the resources. So what do we want to do? Well, once you get all these other points in the pathway figured out, we improve the public awareness campaign, we improve mandatory reporters, we need to put these long-term supports in place for these teams to operate. And do they need to be in every town? No, but in regions like the East Central Corridor, yeah. Like in Des Moines, yeah. So, wrapping it up here, keeping it to an hour. Strengths. Well, we have public education efforts. We've tried. We're doing this right now. We're trying to raise the awareness of elder abuse and neglect. Okay? Those of us who are here, I'm assuming most of us are in the aging network. So give yourself a pat on the back because we're the ones who understand this the most. Problem is we have to kind of let that awareness and resources that we know of trickle out to other places. We have a high dependency standard here in Iowa, and what that means in some respects, if you're a government official, is that's okay, because it keeps the system from being overloaded. What happened in Minnesota when they adjusted the dependency standard to include at-risk and vulnerable older adults, all of a sudden they had a lot more cases turned up, right? Now, if you're a part of an administration that doesn't support the expansion of government in any form, this is not what you want. You want a high dependency standard, meaning you want people to have to really climb up to clear that bar before we send somebody out and spend government resources to investigate. And we do have some leaders here in the state. The group in Polk County was really a pleasure. I mean, we were doing everything you would want to see in a multidisciplinary team. So our weaknesses is we don't have a lot of general public awareness about this. Conversely, the dependency standard being so high, right? On one hand, it's good for government, not overburdening our employees. On the other hand, that's keeping a lot of older adults from being formally interviewed. And then we have a lot of mismatch in the community about what's a successful outcome. Police officers, successful outcome is I drive out there, situation comes down, I don't have to come back out for another 3 months. That's what they define as a successful outcome. It's very different than, let's say, what a care manager would define as a successful outcome. Did they get the appropriate services to get them out of the situation in which they were under neglect? And the APS agent has a different standard. Was this person independent? If not, they're really not my problem. Okay? And then last, the ultimate message here is if you are someone who's perpetrating elder abuse, fraud, or neglect on another person, there's little consequence if you are caught and prosecuted. So, we have a pretty good understanding of what's going on here in East Central Iowa. We understand that you need increased financial and administrative support across all parts of the system. And ultimately, what we want to do is come to forming one of these multidisciplinary teams. So, in my perspective, we're kind of at the front end of this. We have a lot to do. Sorry. It's not going to be solved with just 1 or 2 things here. We have to make a commitment of putting this up on the agenda. So we do have some bills that are currently in play. This is from the group, the Older Iowans Legislature. They took this up as an issue this year, trying to advance some of the notions we put forward about explicating what dependency standards mean, guardianships. And from my understanding, these bills are sitting. They haven't passed both chambers yet. The other thing to be careful about is these are, of many things we could be doing, these are just 1 or 2 pieces. So to think this is sufficient for what we need to accomplish over the next few years, to me, this is just a starting point. And sure. So this came out of the paper last week. I was kind of taken back by it because we were over here talking about it. And on the paper that day, the front page story was about abuse of animals. And I was like, okay, if that warrants the attention of our local press, it's a compelling story. I talked to someone who's a reporter, and they said, oh yeah, whenever we run a story like this, we get tons of comments. But when we run a story about elder abuse, we hardly get anything. And I was just kind of dumbfounded to hear that. So I looked up some of our more prominent leaders, what counties they lived in. You can all do this. These are the puppy mills in their district, so the amount of problems contained therein, I suspect, are I don't know how big, but in their own counties, they had a lot of nursing home deficiencies. And yet, didn't seem to put as much attention in the legislature this year addressing those. In fact, we've continued to cut back on our oversight. I looked at Governor Reynolds. Last fall, you may recall, she made a declaration that we're going to do something about elder abuse. By happenstance, this was our interim attorney general, happened to be here from Iowa. He came out and we had a presentation of our report in an agenda-setting meeting in Des Moines. But then it went away. I don't know where they are. Well, I know he's gone. And I don't know where she is on this, because this really is an executive leadership decision. This is, if you look at our federal system, where most of this stuff should be handled is in a state executive agency. Okay. I heard her dad's in the justice system. He got appointed, but I thought it was like ironic. Well, he would be good to work on this stuff, but I don't know. It's not in the picture either. See, this is another interesting thing. It's like we don't think of multi-generational families like we should be here now. I mean, most of us have 4 generations now. Not evident there. But let's quit picking on government, right? Can't be the solution for everything. Quit thinking it is. Okay, go out and do it yourself. There's absolutely no reason why these healthcare systems can't take a more active role. Back to the Medicare Senior Patrol, back to annual wellness visits, back to Welcome to Medicare. The elder abuse and neglect question should become routine parts of any geriatric screening. I have no idea how often that occurs. If you remember, we don't have a geriatric care system. So what kind of assessments are being given to older adults on a routine basis, including, are you under any sort of exploitation, abuse, or neglect? I have no idea. We don't have a system of geriatric care. You may be involved with the clinic over there, but that's different than having an entire system in which all the physicians are routinely asking older persons. No, that's fine. And why pick on healthcare, right? We have other people who are involved on a routine basis with older adults. Why doesn't Hill Bank or another bank here start sponsoring public awareness slogans like this? We found this over in Illinois. So banks over in Illinois were taking this up as an agenda. So again, I want us to leave this thinking, look, we do have a lot to do, and we shouldn't necessarily look at the government to solve it all. We can engage other members of the private sector to help us out. And so with that, I will take any questions you may have. We're right in an hour, so a few minutes left. Yes, ma'am.
In relatively recent years, it's become common for doctors to ask their female patients, particularly, if you're having any kind of domestic issues. I presume they've been taught to do this in the schools of medicine. Surely something in regards to elders could be taught as well.
Could be. I know, but we just had a report come out. There's an annual wellness visit you can have under Medicare, right? Have you all done that? Right? But do they go through and ask you about abuse or neglect or financial issues? Or I don't think so. So it could be included into that. We just need to have an awareness. The American Hospital Association, you all might be happy to hear this because you started it all, these age-friendly movements, right? There's now age-friendly cities. There's now age-friendly workplaces. And what we're soon going to be getting out of the AHA are age-friendly hospital systems. So as part of that, we would recommend that, yeah, you should have somebody on staff who can help with these cases, just like you have somebody on staff who can help with domestic violence. Yes?
We have our health insurance with United Healthcare.
Mm-hmm.
And I think it was about a year ago, got this phone call from a woman. And I think I hung up on her twice because I thought she was a robocaller, but she was persistent. But she said, then she told me she was with United Healthcare and she wanted to come to our house and go through everything about how we are living as older people. It was a wonderful thing. And I think that the way she conducted this is pretty much what you talked about.
Perfect. So that may be happening more as a part of the insurance, right? That wasn't Unity Point doing that. That was United. Because they, right, probably have more interest in making sure that you're getting not only support when you're at the hospital or seeing your doctor, but they also want to do things like that, prevent any problems. So there's a good example of how a health system can step up into this space.
Do you have any suggestions as to how a person and planning can get out of the guardianship? She's put in a guardianship against her will. Her finances are being squandered. She's being, I consider, abused. And she's gone to every single agency,
17 of them.
and no one will help her. No one.
Can you repeat the question?
She's looking for assistance with a guardianship appointment. And I'm not barred or licensed, so what I would have to do is just say, refer to two people. One would be APS, but I don't think you've been identified as a dependent, or have you? If you have, then APS can help. If you haven't, then Heritage could help, and then they could help with moving forward on where to go with conservative or guardianship.
Who would you get in contact with at Heritage?
Somebody sitting right next to you.
Yeah, no, that's just right there.
Yeah, I was talking to her earlier.
Yeah, somebody just signed off and then suddenly she became under guardianship.
I wouldn't care to comment. I don't know the particulars of the case, and I wouldn't be the right person to recommend it.
Is anyone looking at an oversight group that the guardians are responsible to?
I don't know the internal mechanics of how I know the guardians have to be vetted and they have to go through training and some sort of certification, but I don't know a whole lot more. I don't know a whole lot more. So I'm gonna have to find out.
So, you said they have to, what term you use?
I'm assuming they went through some sort of vetting, meaning I just couldn't become appointed as your guardian unless it was a private.
Oh, I can hang a shingle out and say I'm a guardian. I've been a guardian before.
Okay.
Publicly appointed? Or, okay. I don't know the mechanics of guardianship, so I'm gonna just step off and say.
Either
So it's
contract.
kind of a messy area.
Oh,
There
yeah.
hasn't been.
The other thing I'd suggest is you just retain an attorney.
Yeah. I don't know if other people here might be able to help.
I think we have a few folks in there, but I'm not that person.
I want to relate a personal experience with our county court here. An individual moved into my apartment house about 3 doors down approximately a year ago, and he became a problem and a threat to me right off. He had a very belligerent dog, and I tried everything I could to get along with the individual. So I went to court hoping I could just get a no-contact order against him. Now, the elderly waiver law reads that unless you've been assaulted or you're in some kind of relationship of intimacy with the individual, you can't do that. Now, and later on, he actually threatened to murder me. So, you know, we've got some big problems. If I had $10,000, I guess I could hire an attorney and get him moved next door or something. But I'm just trying to relate what actually is happening
It's hard.
to me. And, you know, we don't have a law that really covers elder abuse in this particular kind of thing.
I think it's a challenge too, because again, each point in the system kind of has a little bit of responsibility, but because they don't have full responsibility, it never. So I can imagine you calling the police, and and the police would come out, and because they don't have that EAGLE system, they kind of just say, "Well, I'm going to walk in and try to diffuse the situation."
Well, this is government housing, and the central office finally told him that he has to stay away from me.
And then there's that. You would engage a care manager, and the care manager might take another approach. And so,
I don't think I need a care manager.
well, a case man, somebody from your agency had to come in there and tell this person to not harass you.
But that, it just.
What would be
it's
my
piecemeal.
agency? Would that be,
Huh?
I didn't understand what you meant
there's a lot of piecemeal solutions out there. It's like, we'll call Heritage, maybe they'll come out there and use the situation.
Well, I think it's under control now, but what I'm
Good.
saying is it's not easy.
No.
Particularly when someone threatens to murder you in this day and age, and I'm a 78-year-old woman, and he's 33-year-old man, 6'4". It's given me rather some anxiety, let's just say that. And I think, now we're just gonna go with it. But I want everybody to hear this, because we don't have a law that covers this kind of thing.
And this is the type of public sharing of information. The more of us know that this can happen, I think the better we can do to move forward on the other points and recommendations.
Give it up for Brian, Dr. Brian today coming out. Yes, so thanks for coming out tonight, today for the program. I did want to do a quick reminder for next month's program. That will be on May 13th. That's going to be the legislative recap, so I hope you can make it. And it will be here at the Coralville Library. And again, next month is also Older Americans Month, so we have one more announcement.
Would you introduce yourself to people?
Me?
Sure.
Yeah. I'm Laura Krieger-Meyer. I'm the Elder Rights Coordinator at Heritage Area Agency. So I receive all the elder abuse referrals, and I assign them out to our elder rights specialists. So if you have any concerns yourself or for someone else, feel free to reach out to us at Heritage. I believe we have some brochures in the back. And you can pull me aside at the end today and talk to me, and I would be more than willing to listen or to take any referrals or give any kind of consultation that I can. So.
Great, thank you so much.
The other thing is, I'm going to put a sheet back there and would like you to put your name and email or phone number. And one thing that you all could do is to go to the governor's office and say to the governor, we need a comprehensive elder abuse law. I've been in contact with the head of the Department on Aging, and we're hoping to get some pressure at that point yet this year. But, we're few in number, but, if each of us go to the governor, I'll bet you it would make one hell of a big difference. And one of the, Larry Kuji, who's the, standing in the back, is the vice chair, and be in September, the chair of the Older Americans Act. And Kay Fisk is a member of that board. And you're all welcome there. But if you put down your email or phone number, I'll keep you informed as to what we're going to do in relation to elder abuse. And as Bruce said, next week, legislators from the state will be here, and this could be an issue that we discuss with them.
They'll be discussing what they have done, but we can also bring up what they have not done and what we want,
And what they can do.
what needs to happen.
Yeah.
Just to add to that, if you can, get a class going here. If you all have, there's enough of individuals in the task force, if enough of you came forward and said, I've been a victim of age discrimination, or I've been a victim of some sort of elder abuse or financial exploitation, and you came together and had those cases, and if those cases happen to have a common theme, like you all lived in a particular retirement community, or it all happened at a certain business, you can take this on yourselves. I just don't see our current administration doing anything more right now than saying, yeah, this is horrible. So if you want to get people's attention, go in the private sector. Go find some cases. Age discrimination is starting to pop up more. and as an extension of that, abuse and neglect. I would contact your AARP. Age discrimination is on their agenda right now, and you're not going to get anywhere with one individual making a complaint. You have to form a class. And so that might be something to do while we wait for a response from the legislature or the governor.
Thank you all for being so engaging today. And also, if you would like Dr. Brian Kaskie's some literature about the elder abuse pathway in East Central Iowa, there will be some packets at the back. Thank you all for attending today. Enjoy the rest of your day.